Hey everybody, welcome to Regulatory Joe. I'm Joe Boyle, president of ClearFile, and today we'll be discussing managing risk adjustment with APTCs changing in 2026. I know we've spoken about risk adjustment on more of a basic 101 level, but just a quick recap on what risk adjustment actually is. Risk adjustment, fundamentally speaking, is the process in which health insurance carriers balance fee payments between CMS based on members' health and the overall risk pool within the individual marketplace. And especially speaking, when we look at the fundamentals of how the ACA was actually built, it was to service members who need healthcare access the most. So risk adjustment, generally speaking, favors carriers that insure and cover the lives of members who are within the lowest FPL or federal poverty level. So when we talk about the balancing of these complex fee payments during uncertain times and the potential elimination of APTCs during calendar year 2026, the fact that we're in enrollment and still don't have a clear path into January 1st of next year, plans need to start strategic planning now, specifically around your risk adjustment process. Now, you may be thinking, well, I have to plan for new state mandates next year. I have to plan for lessons learned. How will I ever find the time to actually plan for risk adjustment? From a timing perspective, we know that going into January of 2026, we'll actually be adjusting the risk calculation payments for the past 2 calendar years. So again, starting your planning for uncertain times with the elimination of APTCs is going to set you up for success, not just for plan year 2027, but plan year 28 and even into plan year 2029. So what exactly is changing in calendar year 2026? APTCs are set to sunset by the end of calendar year 2025. So starting 2026 with no APTC or subsidy eligibility for members falling within the federal poverty level, participating within the individual marketplace. And the impact of what that actually has on risk adjustment is quite significant, because the process upstream, we're already starting to plan portfolio strategies for plan year 2027 while starting to adjust the risk for the past 2 plan years. So we're encouraging issuers to focus not just on future year planning, but making sure that you have a good harness on the past 2 plan years of data, because methodology is changing with the risk adjustment models, especially the HCC ACA model. And that being said, at the end of the day, where plans are losing money with the reduction of APTCs, they have to make up those dollars in a different way. And quite frankly, the options are very limited. So one way of actually doing that is to raise costs of the actual medical benefits that are filed within a product portfolio, directly impacting the downstream process of risk adjustment. And when we think about the domino effect that the removal of APTCs has a direct impact on members not receiving the care that they need. As that gap of access to care increases between the members and the providers, we can only expect that when complex conditions do arise for these members who are already compromised with their healthcare needs, those conditions will actually be at a greater level than what they already would have been if members had the APTC and financial sufficiency to actually pay for their coverage upfront. And we can quantify this at the end of the day as having an overall greater unhealthy member population, creating much more risk for the health plan carrier, which at the end of the day, issuers may not even see how the total impact to the single risk pool may wash out until calendar year 2027, after plan year 2027 filings have been submitted and approved. And with APTCs, this being the first year it's ever been a question on the table, coupled with a year we're seeing large carriers exit the marketplace, there's a preconceived notion that, who would ever enter the federal marketplace or the ACA marketplace for plan year 2027? Well, we are seeing some health plans seeing this as an opportunistic time frame to actually enter the marketplace and participate with the ACA in a year of uncertain change. For the issuers brave enough to actually enter the marketplace for plan year 2027 during a year of uncertain change, I would encourage you to familiarize yourself with some of the rules of the road of being a first-year issuer dealing with the risk adjustment and edge server process. First-year issuers will get an option based on your projected membership or how many members you think that you will actually get onboarded and effectuated within your health plan, a decision whether you want to make a default charge to stand up your risk adjustment process or actually pay to have the whole risk adjustment process stood up, even if you have limited or low membership for that first year. We all know that risk adjustment inherently is based off of projections, so making sure you get your year 1 membership projections right is going to be critical and crucial. On the contrary, a renewal market or a renewal issuer that's participated within an exchange, individual, small group, on exchange or off exchange for many years, already has a edge server stood up, their risk adjustment process is underway, and they've most certainly participated in a RADV audit by CMS. So even though this process occurs after your core filings, after defining your core plan strategy, we still need to make sure that issuers are staffing and resourcing for the overall risk adjustment process upfront so they can satisfy the requirements downstream. So in terms of preparation for a new plan year, it's going to be critical to pay attention to a couple different things. Where in prior years, we would advise our issuer partners to begin their strategy planning in Q1, we're actually telling carriers to start strategy planning right now in their current calendar year. We can't waste any more time waiting for additional state-based guidance or federal guidance from CMS, as by this time last year, the Notice of Benefit Payment Parameters draft was already released and we were already able to get to work, which encompassed risk adjustment parameters, including all the net new diagnosis impacts this time last year already. Now we know again that the Notice of Benefit Payment Parameters last year was finalized in about February, I think the second or third week of February. We're now expecting that to be delayed. We've seen carriers struggle with this in the past where they're waiting or dependent on their state and federal guidance before they make business decisions, but we're encouraging our carrier partners to establish a working group or to establish a forum to actually start making business decisions up front so you can make quick pivots as needed in February and March of next year. We're also encouraging carrier partners to make courtesy calls to your regulators, reach out, make it intentional that you want to continue to participate in a marketplace, and review opportunities for improvement, not just with your internal teams, but with your reviewer partners to how to make the process easier for next year and get their thoughts on risk adjustment. What are they seeing for APTCs? And collect that feedback loop. This is also a perfect time to get with your finance and actuarial teams to making sure that your cash reserves and finances are in order. We do know that some states are looking at carriers to making sure that their pro formas are up to date, especially as membership ebbs and flows, making sure carriers have the cash reserves to actually pay for high-cost claimants as it relates to the risk adjustment process. So would not be surprised if this was a year of higher volume of questions from your regulators regarding your business operations or looking for more ACA-specific driven reports as it relates to financials, financial statements, and projections based on your membership. It's really all going to walk back to how you populate your unified rate review templates when you have your actual membership versus your projected membership and how that's filed with your regulators. That will all flow downstream through the review. If you can get ahead of that with your reviewers, that'll save a number of hours during the objection process. And finally, have a good look at your MLR, your medical loss ratio, which again, as a reminder, it's your claims divided by your premium dollars. So again, as APTCs are eliminated, premium dollars change. There are no more subsidies. Claims will be changing. The way members go to the doctor will be changing. That ratio or percentage will ultimately be impacted. See where you're falling. If it's 70, 80, or 90% MLR, I would actually look back a couple of years to see how that trend has changed and how that volatility will continue forward through plan year 2027. We'd also encourage our issuer partners not to lose sight of RADV audits. And again, RADV is short for Risk Adjustment Data Validation, RA for Risk Adjustment, DV for Data Validation. So while we can spend all the time up front planning for risk adjustment and to actually get those calculations for the payment itself, we want to encourage issuers to plan, staff, and prepare for RADV audits. Just making sure that you have the staff on hand to support the audit, as CMS has made it clear that they will be increasing the scope of how they conduct RADV audits by the volumes of materials that they request. So I'd prepare for more data requests, more RFIs, and potentially more scrutiny during the review period. As risk adjustment is such a big driver for healthcare financials, we definitely want to make sure our issuer partners and anybody listening is prepared for plan year 2027. So definitely make this a priority for your plan going into your portfolio preparation for next year, whether you're participating in the individual marketplace or the small group marketplace. And just to put a bow on it as well, the process is required, it's not going away. So any business process you establish during the first year of APTCs being sunset, we definitely want to make sure you have codified business procedures internal to your organization to support your team. Thanks everybody for listening. That's a wrap. Give us a like, give us a share, and we'll see y'all next time.